Ladies and gentlemen, welcome back to On with Mike. It is the premier business radio program. I'm your host, Mike King. This is part of Poplar Springs UHS Hour. Welcome to the program, sir.
Hello, welcome. Thanks for having me.
All righty, as I always say, this is a business show, so tell us who you are and what you do.
I'm Dr. Ronald Mazak. I'm the Director of Addiction Services at the Virginia Beach Psychiatric Center, currently in charge of all the acute detox patients that come in for help for their alcohol and drug issues.
All righty, as we're coming out of the holidays and we're moving into the beginning of the year, have you noticed anything different? Are we doing better as a society with dealing with alcohol and drug abuse issues?
Generally speaking, yes. I mean, the recognition of alcohol and drug use as a disease, as a disorder that can and should be treated medically, we're slowly moving in that direction. We have more resources available, and highly trained individuals and addiction medicine programs to help increase the number of providers to address this issue. We're currently, I don't believe, where we need to be insofar as having enough people to address the huge need for both drug and alcohol treatment.
Are we, as a society, when we look at each other, you think that we're better off now than we were, say, 10 years ago? Are we more, and do you think that COVID played a part in that?
No, I don't think we're, generally speaking, as a society. I've noticed a distinct change in our day-to-day interactions with each other, particularly post-COVID. I think that isolation resulted in people in general forgetting about, how to be kind to each other and how to interact with each other in a respectful manner on a daily basis. Insofar as what I do, I have a plethora of patients that were beginning their treatment, beginning their recovery journey. And when COVID hit, they found themselves, bored, isolated, and they would resume their use of alcohol and drugs. So definite surge in cases, both during and after the pandemic.
Which age groups do you handle at your facility?
Well, anywhere from 18 to 80, basically. The vast majority of those would fall in the 25 to 50-year-old category. Not very many younger people from 18 to 24. And then, basically the extremes of age are not very frequent, but the middle of that bell-shaped curve, 30 to 50, that's a good 75% of our patients.
As a family, what are some of the signs that we would look out for that our loved one needs help, needs assistance?
Well, basically any change in behavior over time, isolating themselves, not spending time with family and normal activities, problems with work attendance, tardiness, change in appearance, not caring for oneself as you typically would. People that are using drugs or alcohol, they don't care so much about personal hygiene as they typically would. Changes in behavior, things like that. Physical signs of possible use, including paraphernalia, alcohol bottles scattered about.
How far away? Which areas do you guys cover? Do people come from far and wide?
They do. They come from everywhere, 5-6 hours away. So basically, all of Virginia is the area we service.
All righty. So what we do is when we talk to people on a daily basis, what we do is we talk to them about their journey. What was your journey to get to where you were?
Well, I was an anesthesiologist for 20 plus years, and I just was becoming very disgruntled, dissatisfied with that particular specialty, and quite frankly, medicine in general. I had strongly considered just not being a doctor anymore. I wasn't deriving any degree of satisfaction from what I was doing. I didn't feel like what I initially started doing was what I was currently doing. I wasn't, didn't feel like I was helping people at all, and that was right around the time the opioid epidemic had really started to surge, and I looked into maybe doing a fellowship in addiction medicine, which is an additional 1 year of training. Once I realized, with the help of my family and support of my family, that they would support me basically going away for another year of training, I pursued that option. So I went to the University of Florida. I did a 1 year fellowship and returned, and I've been working at the Virginia Beach Psychiatric Center ever since. And I can say, my only regret is not doing it earlier, because the degree of satisfaction that I derive from doing this, and the gratitude that I feel from my patients, it's very, very heartwarming. And it's been kind of transformative in my practice, and just in my overall love of medicine. Again, I feel like I've rekindled what I originally signed up for, so to speak.
One of the things that when we look at it is, what's the average stay for your patients?
I'm sorry, Mike, I didn't hear that.
What's the average stay for the patients at the facility?
Oh, okay. Thank you. The typical detox is approximately 5 to 7 days, and that's just to get through the acute phase of detox. Alcohol and benzodiazepine, Valium, Ativan, Xanax, particularly. Those, if they're not managed medically properly, can kill you. You can have multiple seizures, you can die. So alcohol and sedative detox has to be done in a medically supervised environment because of those risks. Opioid detox, similar time frame. You're not going to die if you abruptly stop your use of opioids. You may feel like you want to, but there's a way that it can be done and managed in a more safer environment, and a lot easier on the patient. Oftentimes, if patients try to stop using opioids on their own, they just ultimately, within a day or so, end up using again. So being in this environment, makes it easier on them, number one, and it also prevents them from relapsing and using again.
So do you see patients on a relapse basis? Do you see people coming back through a number of times?
Yes. Yeah, relapse is part of the disease of addiction. So it's anticipated, and it's something that I see on a very frequent basis, which is both encouraging and discouraging. It's discouraging that you need that people don't get it right the first time, so to speak. But that's okay. As long as they're alive and willing, they've got a chance at recovery. It is encouraging insofar as, they are coming back. They're not just throwing in the towel and giving up and saying, I can't do this. I've had many patients on their 5th, 6th, 7th time, because you just never know when someone is going to be, they're going to have that epiphany that they say, hey, I'm going to stop using now. I always assume it'll come. I never give up on anyone. It doesn't matter how many times they come for treatment, they're always welcome.
So I guess for you, this is more rewarding and personal, because as the anesthesiologist, it's like you see a person right before, and then that's it. You don't see them.
No. I mean, I could be nice to anyone for 5 minutes, and that was the initial appeal of anesthesiology. But as I progressed through my career, what I thought was initially what I wanted, namely brief interactions, is something I actually missed. And I think that's a big part of why I was becoming so disgruntled and dissatisfied in my career. I really wasn't making any human connection. I was just moving people through the OR, like a mass assembly line, and not connecting with them at all. Whereas now, I spend a decent amount of time with people, talking to them, getting to know them, and actually feel like I'm helping them. And I know this for a fact because they tell me how much they've been helped, and you can't imagine how satisfying that is.
How do you keep your staff together as everyone has staffing issues? Everyone has trouble with their staff as far as keeping them safe and healthy and all that. What's the trick?
Well, the trick is, like open communication. I think that's the key to most things in life, is expressing your concerns, looking for areas where people are struggling. Like is endemic in medicine in general is just the chronic understaffing, which, as you're aware, can lead to burnout. And that's just an unfortunate reality of what we're dealing with now. But self-care is paramount. When you recognize that you're becoming stressed or burnt out, maybe offering a kind, encouraging word to someone, helping them out as much as you can. We're a very tight-knit group here, and we work together well, and we kind of have to, given the circumstances we're dealing with and the issues that we're facing. In an ideal world, we'd have adequate full staffing, but that just isn't the reality. So recognition of that fact, and then being proactive in preventing burnout and other stress-related issues, it's extremely important.
All right, Doc, we'd like to thank you for coming on the program. How can people find information about your team?
I'm sorry, Mike, you broke up there at the end.
How can people find out information about what you guys do?
Okay, you can come to the Virginia Beach Psychiatric Center, visit our website. I personally, like I said, I'm a board certified addiction fellowship trained physician. I'm one of the few in the area. I'm very, very motivated in doing what I do. I'm always available for calls. I give patients my card every time they leave with my phone number they can contact me with. But circling back in general, just stop by the Virginia Beach Psychiatric Center or visit our website, and visit LinkedIn as well. I have a nice page linking to my qualifications and my basically treatment philosophy. So.
All right, Doc, we'd like to thank you for coming to the program. This has been On the Mic with Mike King here. Dr. Mazur, thank you, sir. Take care now. Have a good one.
You're welcome.
Thanks.
You too.
Bye-bye.
Thank you. Pleasure.